Well, there's been some concern about how COVID-19 vaccines might impact fertility for couples, but new studies are shedding light on the associated risks and if there are any. Here to talk about this is Doctors Parviz Kavusi and Shahryar Kavusi. They're brothers and they treat fertility patients at St. David's South. Thank you both for joining us.
Thank you for having us, Rebecca.
I'll start with you, Dr. Parviz. What misinformation have you heard regarding vaccines and fertility during the past several months?
So there's been a number of things that have come up that we feel really is misinformation. One is we're hearing it from patients, and others we're just seeing it online. One is that the vaccine is actually going to make men infertile, even sterile perhaps. And that's just something that is kind of culminated online and in social media, and it's really brought a lot of concern to patients. The second is that the vaccine has a potential of actually entering the DNA of sperm and causing changes there, where there's lots of data showing these types of vaccines, mRNA vaccines, cannot enter the nucleus of a cell. So there's been an awful lot of misinformation that's caused a lot of concern, fairly unnecessarily.
Dr. Shahryar, what have these new studies found about the COVID-19 vaccine and fertility in women?
Well, they've been very reassuring. That's the good news. And just to preface it, I mean, there was a lot of misinformation online and social media about COVID-19 vaccines in women who wanted to conceive. And the idea that was brought forth and that was erroneous, it was not right, was that COVID-19 vaccines will create these antibodies that not only attack the spike protein of the SARS-CoV-2 virus, but also, this is the erroneous part, the false part, that they would also attack a placental protein called syncytin-1. And syncytin-1 is not something that this vaccine will attack. That's been shown in laboratory studies now. So the new studies have shown in vitro, like in a laboratory, that these antibodies do not attack that placental protein. There's another study that was just published, actually, that was a clinical study. It's very nice to see right now, that looks specifically at 3 groups of women who had embryo transfer. So we're looking at implantation directly in this study. That's what was looked at in the study out of Illinois. They looked at 3 groups of patients, women who had antibodies to the SARS-CoV-2 virus due to COVID-19 vaccination. So they had vaccinated themselves, they had been vaccinated and they basically had antibodies, versus ones that had antibodies who had previous COVID-19 infection, actually. And then women in the 3rd group had no antibodies at all. And all 3 groups had similar implantation rates with embryo transfer. And they had early pregnancy results that were similar across all 3 groups. So this study shows that infertility is not something that the COVID-19 vaccine brings about. And that's very reassuring. And placental studies have shown no difference in pathology in women who have had COVID-19 vaccination after they deliver, and the placenta has been looked at in a laboratory. So that's also reassuring.
All right, Dr. Parviz, what about fertility in men who've been vaccinated against COVID-19?
Yeah, there's been a study that was just recently published out of University of Miami in JAMA, that it was a small group of men, but it showed a great deal of consistency in the results, where they took 45 men that didn't have risk factors for infertility, checked their sperm parameters, and then gave them the vaccine, and 70 days later did a repeat semen analysis to reassess sperm parameters, see is it doing any harm to fertility potential. And they found that there was no decrease in sperm production or any of the fertility parameters that we look at on semen analyses after the vaccine. In fact, interestingly, the numbers were actually higher after the vaccine. Now, that's not suggesting it's making men more fertile to get the vaccine by any means, but there's some variation from test to test. It's showing clearly, consistently, that with both the mRNA vaccines, the Pfizer and the Moderna one, the groups were nearly half and half of the men on each vaccine, that there was not any decrease in semen parameters, giving a lot of reassurance to what we already believed scientifically in how these vaccines work, that they should not affect male fertility. Now we've got good data showing us that they really don't.
All right. Doctors Parviz and Shahryar, thank you both for sharing your time and expertise with us tonight.
Thank you.
Thank you.